Bismillahirrahmanirrahim. I'm Dr. Mohibullah Wazir. We describe the posterior division of the mandibular nerve. Look, this is the trigeminal ganglion, and it gives three branches, that is the ophthalmic, the maxillary, and the mandibular. And then this mandibular nerve or sensory, it is then being joined by the motor root of the trigeminal nerve. And in this way, the mandibular nerve becomes the mixed nerve. And then it comes out of the skull through the foramen of veil and immediately gives one branch, that is the meningeal branch, and then nerve to medial pterygoid, which also supplies the tensor terpeni and tensor villi palatini. Then the mandibular nerve divides into two divisions. Look, this is the anterior division, which we have already described, and then this small is the anterior, and this big one is the posterior division of the mandibular nerve. The posterior division, now it is all sensory except one, and the anterior division is having all motor fibers except one branch, which is sensory. Now the posterior division gives many branches and only one motor, that is nerve to mylohyoid and anterior belly of digastric. The other are all sensory and having also secretomotor fiber. Let us describe the branches of the posterior division. Now look, the first branch of the posterior division, you can see this auriculotemporal branch originating from posterior division by two roots and then passing posterolaterally towards the ear. And note, this auriculotemporal nerve is sensory to number one, the TM joint, and number two, to the ear pinna above the extravellocaustic meatus, and three, to the skin of the extravellocaustic meatus, and four, to the outer surface of tympanic membrane, and five, to the skin of the temporal region. And then note another important point, that this auriculotemporal nerve, it takes the postganglionic secretomotor fibers from the otic ganglion, and then these fibers are given by the auriculotemporal nerve to the parotid gland to increase its secretion. This is auriculotemporal nerve. Then the second branch of the posterior division is, look, this branch, this inferior alveolar branch. Alright, and this inferior alveolar branch, you look over here please, you follow this inferior alveolar branch and you will see this inferior alveolar branch, it comes to the medial surface of the mandible. Look, it comes to the medial surface of the mandible and it enters through this mandibular foramen into the body of the mandible to run in the mandibular canal. While before entering into it, one branch is given, that is nerve to mylohyoid muscle, and that runs in this mylohyoid groove. And in this way, the inferior alveolar nerve, the second branch of the posterior division, it gives number one, nerve to mylohyoid muscle. And look, this is nerve to mylohyoid muscle. It runs downward and reach to the floor of the mouth, and it supplies the mylohyoid as well as anterior belly of digastric. This is the only branch of the posterior division that is motor, and it supplies the mylohyoid and anterior belly of digastric muscle. Then the nerve runs over here, in the body of the mandible, in the mandibular canal, and it gives branches over here to these teeth, and the branches are given to the root of the teeth, and then the incisive branch is being given also to the canine and incisor teeth, and one branch of it that comes out over here through this foramen, which is mental foramen, and that is also called as mental nerve. It comes over here out of the mandible through the mental foramen and supplies the lower lip mucosa and skin, and also look the some glands over here, and because having some secretomotor fibers over here as well. In this way, the inferior involuntary mylohyoid, which supply the mylohyoid muscle and the tubular gastric, and then supply the root of the teeth of the mandible and incisive and canine teeth, as well as the skin over the chin, and as well as the skin and mucosa of the lower lip. And then the third branch of the mandibular nerve, that is the lingual nerve. And now you look over here, please. This is the lingual nerve. Note, as soon as the lingual nerve separates from the posterior division of mandibular division, note very clearly, make it clear in the photo, it is being joined by this cauda tympani nerve. And this cauda tympani, you know, it is the branch of the facial nerve. And in this way, now the lingual nerve that descend downward, it is having its own fibers from the mandibular division, and then also having the cauda tympani fibers. Now the lingual nerve by itself descend downward, and it reaches over here to the tongue, and it supplies sensory supply to the anterior two-thirds of the tongue and floor of the mouth. Sensory supply from the anterior two-thirds of the tongue and floor of the mouth. While the fibers of the cauda tympani, which runs along the lingual nerve, what they do? Look, they pass to the submandibular ganglion, parasympathetic ganglion, relay over here, and the postganglionic fiber that originate from over here, these are being distributed to the submandibular salivary gland as well as to the sublingual gland. Okay, and in this way, the lingual nerve supplies the anterior two-thirds of the tongue for the general sensation, and through the cauda tympani, it supplies the submandibular, sublingual, and also the gustatory or touch fibers from the anterior two-thirds of the tongue, but this function is being done by the cauda tympani part of the lingual nerve. This is all about the mandibular posterior division. Thank you very much.